Good morning. Can you all hear me? Oh, there we go. Good morning. We're going to go ahead and get started. We have a busy day, so we're going to go ahead and get things going. My name is Judy Staffa. I'm the Associate Director for Public Health Initiatives in CEDAR's Office of Surveillance and Epidemiology. And right now that means I oversee all the post-marketing activities of our office in the area of opioids. So on behalf of my office and the Office of Biostatistics, who has co-sponsored this meeting with us, I'd like to welcome you to this very important discussion to be talking about what more we can do to improve our data and methods to be evaluating the impact of opioid formulations that are designed to deter abuse. Thank you all for coming, and what I'd like to do, just a couple housekeeping things. If you have not yet registered at the front desk, please do so. Please make sure to silence your cell phones and other devices. There's copies of the agenda and the slide sets. And in the slide sets are the discussion questions for each session, if you'd like to be able to look those over. All the materials for this meeting have been posted on the FDA meeting webpage. As you speak, please make sure you use a microphone. The meeting is being transcribed as well as webcast, and the transcription will be available in about 6 to 8 weeks. The restrooms are located out the door and to the right. So what I'd like to do is start off. We've assembled a very eclectic panel, and I'd like to just have everyone go around our panel and introduce themselves, both our outside experts as well as our FDA folks. So if we could start on that end with Dr. Jones, would you be? Thank you.
Chris Jones, I'm the Acting Associate Deputy Assistant Secretary for Science and Data Policy in ASPE at HHS. I have worked on the opioid issue for a number of years.
Fred Conrad from the University of Michigan. I'm a survey methodologist and direct our graduate program in survey methodology.
I'm Teresa Cassidy. I'm from Inflection, and my background is in epidemiology and post-market surveillance of prescription medication abuse.
Good morning, everybody. My name is Dan Ciccarone. I'm from the University of California, San Francisco, Department of Family and Community Medicine. I'm the principal investigator of the Heroin in Transition study funded by NIH NIDA.
Good morning. My name is John Brooks. I'm the Senior Medical Officer for the Division of HIV and AIDS Prevention at the Centers for Disease Control. And I was also the Incident Manager for the Indiana HIV and Hepatitis C outbreak in 2015.
Hi, I'm Elizabeth Crane with SAMHSA, Substance Abuse and Mental Health Services Administration. I was with the Drug Abuse Warning Network for many years until its phase out. And now I'm leading the Ambulatory Care Services team, which is partnering with NCHS on the National Hospital Care Survey.
Good morning, my name's Louisa Degenhardt. I'm from Australia. I conduct a range of different studies looking at illicit drug use, but we've been conducting a range of post-marketing studies in Australia over the past 10 years.
Hi, I'm Barry Grobard. I'm from the National Cancer Institute, and I'm a biostatistician.
Hi, I'm Vin Loray. I'm from the Division of Infectious Diseases at the University of Pennsylvania and the Center for Pharmacoepidemiology Research and Training.
Good morning. I'm Carol DeFrancis. I'm Chief of the Ambulatory and Hospital Care Statistics Branch at the National Center for Health Statistics. We are working with FDA and SAMHSA on the National Hospital Care Survey to identify substance-involved ED visits.
Hi, I'm Erin Krebs. I'm a general internist and health services researcher at the Minneapolis VA and University of Minnesota. My research focuses on chronic pain management, opioid benefits and harms in the primary care setting.
I'm Scott Novak with Battelle Memorial Institute, and I direct their program on prescription drug abuse and drug safety, and I am an epidemiologist and biostatistician.
I'm Dan Budnitz. I lead the Medication Safety Program in the Division of Healthcare Quality Promotion at the Centers for Disease Control and Prevention. I conduct some national adverse drug event prevention and surveillance programs.
Good morning, I'm Sid Schnall, Penny Associates. I head up the risk management programs there, and I've been working in this area of addiction and pain for close to 50 years now. Been around a long time.
Hi, I'm I'm Elizabeth Sherman. I'm a professor of clinical pharmacy at West Virginia University and director of the West Virginia Poison Center, where we manage overdose and poisonings and submit data to the National Poison Data System. I'm also here representing the American Association of Poison Control Centers. For the last 25 years, I've chaired the committees that are working on quality improvement and coding accuracy in the National Poison Data System.
Hi, I'm Abby Sherman. I'm an associate professor of biostatistics at The Ohio State University.
Good morning. Peter Kriner from senior scientist at the Institute for Behavioral Health at Brandeis University in Massachusetts. I had several projects that work with state prescription monitoring programs and work with prescription monitoring program data.
Good morning, my name is Richard Nieck. I'm a professor at the University of Michigan. I'm principal investigator of a project called Monitoring the Future, which surveys about 40,000 adolescents every year about their drug use. We also follow them into adulthood.
Morning, I'm Jay Unick from the University of Maryland School of Social Work, and I work on a number of projects related to opiate overdoses.
Good morning, my name is Nabarun Dasgupta. I'm an epidemiologist based at the University of North Carolina in Chapel Hill, and I have appointments at the Injury Prevention Research Center in the School of Pharmacy, and I also work with the radar system.
Good morning. I'm Leland McClure, forensic toxicologist and corporate medical affairs director for our prescription drug monitoring program at Quest Diagnostics. And I've been involved with opioids and testing back to, gosh, my medical examiner days, back starting in 1980.
Hello, I'm Jennifer Parker. I'm at the National Center for Health Statistics. I'm a biostatistician in the Division of Research and Methodology.
Good morning, I'm Wilson Compton, the Deputy Director at the National Institute on Drug Abuse, and it's a pleasure to see so many old friends and a few faces that I get to put with names that I've known.
Hi, I'm Jody Green, the Director of Research at Rocky Mountain Poison and Drug Center, which also owns and operates the radar system, and my background is in applied statistics and research methods.
Hello, I'm Holly Hedegaard from the National Center for Health Statistics. I'm an injury epidemiologist in the Office of Analysis and Epidemiology. And most recently I've been working on literal text from death certificates and also working with coroners and medical examiners to improve the quality of the information on death certificates around drugs.
My name is Ed Boyer. I'm a medical toxicologist, an emergency physician, and a synthetic organic chemist. I'm currently at Brigham and Women's Hospital and Harvard Medical School. My research interests are all over the map, so I won't even try to describe what they are.
Morning, I'm Doug Throckmorton. I'm the Deputy Director for Regulatory Programs in the Center for Drugs at the FDA.
Hi, I'm Jana Makinich. I'm a medical officer and epidemiologist in the Office of Surveillance and Epidemiology on the prescription drug abuse team.
Hi, I'm Tamara Meyer. I'm an epidemiologist on the prescription drug abuse team as well in the Office of Surveillance and Epidemiology.
Good morning, I'm Scott Goldie. I am Special Assistant in the Office of Biostatistics in Cedar.
Good morning, I'm Cynthia Koenig. I'm the team leader for the prescription drug abuse team in the Office of Surveillance and Epidemiology.
Good morning, my name is Hannah Lee. I'm a biostatistician from the Office of Biostatistics in Cedar at FDA.
Hello, I'm Mark Levinson. I'm a division director of one of the biometrics divisions in Cedar. Our division deals with drug safety and real-world evidence.
Good morning, my name is Kuntal B. I'm a statistician at FDA.
Good morning, I'm Joan Shi. I'm a statistician in the Cedar FDA.
Great, thank you everyone. We have quite the group here. So before we get started, I'm very honored to be able to introduce our commissioner, Dr. Scott Gottlieb, who would like to provide some opening remarks. Dr. Gottlieb.